think we'll go ahead and get started. I think we've got quite a few people here. Wanted to thank you again for attending our Parent University webinar this evening. My name is Ann Risso. I work for the Douglas County School District Communications Department. And welcome to our last Parent University webinar of the academic school year. With our partnership with Skyridge Medical Center, we try to provide engaging and relevant content to all of our Douglas County School District parents. And I would like to introduce our guests and panelists this evening. We've got Dr. Matthew Hadid and Dr. Becca Hadid. Dr. Matthew Hadid is the pediatric hospitalist and the pediatric department chair for Skyridge Medical Center. And thank you to Skyridge Medical Center for allowing us to borrow Dr. Hadid for this evening. We appreciate it. Dr. Becca Hadid is our other panelist. She is a general pediatrician at a nonprofit pediatric clinic in Aurora called Every Child Pediatrics, and it provides medical care to the underinsured and underserved community. And you did hear that correctly. They have the same last name. They're actually spouses, and they have a 2-year-old daughter and a second baby on the way. So that's very exciting. So as you can see, pediatricians are just like us. We're all trying to figure out what's going on in our children's brains and what to do with parenthood. And we've probably all had the experience of trying to figure out that first time of getting the car seat in the car and driving. So thank you for being able to relate with us. If you have any questions during the webinar, please use the question and answer area, and we will answer all questions after the webinar. You can also raise your hand or send a question with the chat option as well. And with that, I will send that over to our wonderful panelists. Thank you.
All right. So just kind of an outline of things we'll kind of touch on. Brain development by age, kind of some highlights of certain goals and certain things we tend to see, check boxes that we'd like to see with kids as they grow up, and kind of foreshadowing what we expect to see into adulthood. And then some of the issues that adolescents face. These are big topics. There's endless topics, but these are the big ones that we as pediatricians get asked about all the time, every day. And so just a few of them touching on to kind of highlight some things and how these big topics can affect our preteen and teenagers' brain development as they go throughout their schooling and into adulthood. And then last, we'll kind of touch on things to help best guide your teenager. So brain development is a huge topic, and depending on the age, in pediatrics, we cover so much in the way of milestones, developmental checkboxes and all that, because every age there's huge differences in what we expect to see and what we like to see, which sets them up for a successful adulthood. And so just kind of some big interesting stats here. So as a newborn, the brain weighs about 13 ounces, which compared to an adult brain of 3 pounds is quite a bit smaller. But by 90 days, the brain is about 64% larger than at birth, which is pretty astounding. At 2, toddlers have about 50% more synapses in their brains than adults do, actually. So I know that kind of sounds counterintuitive, but there's a process called synaptic pruning, which kind of goes through and weeds out. Imagine you have a rose bush and you're kind of trying to cut out some of the extra stuff that you don't really need. All these kiddos, toddlers, are developing so much in the way of synapses and brain growth that there's a lot of overlap and redundancy there. And so a process that our brain goes through throughout our lives, but is really robust in the toddler period, is something called synaptic pruning. So it's kind of weeding out some of the things we don't need as an adult. By 5, the brain is about 90% of the size of an adult brain, which sounds like a lot, but there still leaves a lot more room for development, even in that last 10% of size growth. Scans of normal kids have revealed that there's different parts of the brain that develop at different rates. And one of the big things that we talk about in developmental pediatrics in preteens and teenagers is something called the prefrontal cortex. So the front part of the brain that sits kind of right behind the eyes. And that controls a lot of your like executive functioning, your ability to plan ahead, see consequences, things like that. That's one of the last parts of the brain to develop, which we'll go into a little bit later. The amygdala, for another example, is a part that sits kind of in the center of the brain. And that's one of the parts of the brain in a human that develops the fastest and matures the fastest. But that part of the brain is responsible for emotion, aggression, instinct, and sort of reflexive responses, which is also why we have the teenage angst sort of phenomenon we see with a lot of that. And so we'll touch on that later. But there's a lot of imbalance between parts of the brain that develop, and so that often leads to that teenage brain where they're making not so much great decisions sometimes, but we help guide them through it because of that mismatch. And then experience and environment are huge influencers on brain development for teenagers, and what they see and experience as a kid definitely affects their brain development as they get older. So you can kind of see here lots of different things happening in a teenager's brain. Not so much exactly where those parts of the things are happening in the brain, but you can just see that there's a lot going on. You can see in this depiction, the brain's going through so much in the way of maturation and changes throughout their childhood. And so even from 5 to 20, we can see a huge increase. Can you see my mouse? Does that work? Mm-hmm. On the screen? Well, anyway, so there's a lot of in the 5-year to early teen range, there's a lot of what we consider white matter. And so that's part of the brain that controls nerve conduction and how fast different parts of the brain are connecting with each other. Whereas as we get older, we see something called gray matter volume, and that's the blue areas. That is something that we see as we get older and mature. The gray matter is is kind of where all the brain cells are at. And that's what the complexity of our decision making, the complexity of our brain functioning is kind of living in the gray matter of our brain. And so you can see from a 5-year-old to a 20-year-old, there's a huge increase in gray matter production. And so that's, just goes to show us how much of a developmental growth they go through in that first 20 years. And, maturation and all that. Definitely by, a lot of developmental pediatricians say 25 to 30 range is where the mature amount of gray matter of an adult brain is kind of reached. All right. So big topic, obviously, in teenagers is substance abuse. And we'll talk about a few different things, and then how do you talk to your teen about that? But knowing statistics about a lot of these is pretty astounding and important, I think, as a parent, but also as a teenager to know too. I like this slide a lot. Almost 50% of teens have tried alcohol. That's a pretty big number. Almost 40% of teens will have vaped nicotine. This is all by 12th grade. And then over 40% have used an illicit drug by the time they're in 12th grade. In 2021, there was a study that came out that showed about 7% of 8th graders, 17% of 10th graders, and 30% of 12th graders reported using marijuana in the last 12 months. So we know it's happening even amongst the middle school age kiddos. And we know that drug use, marijuana, nicotine, alcohol, all of those things can affect early childhood and adolescent brain development. And you can just kind of see some of the things that we see from there: increased mental health outcomes, school failure, or truancy, impaired memory, loss of interest, mood swings. We see a lot of these sort of withdrawing behaviors amongst teenagers that are using substances. And then I think it's also important as a parent to know why our kids are using substances. If it's issues with managing peer pressure, if it's stressors at home, stressors at school. There's a lot of research out there amongst family history. And so if there's a strong addiction history, then kids are more gravitated towards trying and then abusing. And then if they're seeing it at home or at school or with their friends, the more they are exposed to it, the more likely they'll try it. And then availability too, if it's there. And so, sorry, I'll go back there. I think, you see it a lot in your teenage population.
Yeah, and I think a big takeaway on this with a lot of these topics, but particularly this is I see the most success in families who have open communication from a very early age regarding all of these topics: drugs, sex, alcohol, all of the things, so that your teens can know that it's a safe topic and it's a safe place to talk about it, to have that support in their lives, and know that that's an ongoing, evolving, open communication. That's where I see the most success. And the other piece as well is, especially now, there's always, unfortunately, really limited mental health resources. And so as primary care pediatricians, we end up treating a lot of mental health, a lot of depression, a lot of anxiety in kids and teens and adolescents. And there's a lot of correlation between some of these substance use, especially marijuana, and its link with mental health issues that can cause worsening depression or anxiety, also can trigger psychoses and different things like that, and early sign of schizophrenia. So it can really be detrimental if there's already underlying mental health issues going on as well.
And all those, mental health issues can also increase risk of things like addiction, and that imbalance between, as I was mentioning before, that prefrontal cortex, their ability to make executive functioning, informed decisions, and their impulse control part of their brain are imbalanced. And that impulse control part matures faster, so they are sensation seeking. And so that increases the risk of addiction and a history of mental health, just predisposes kids to this substance abuse disorder where they become addicted to a lot of these things. Cigarettes, vaping, we know nicotine is a huge addictive chemical. And so those traits, if you know that your kiddo, there's a family history of mental health disorders in the family, they're at even more risk.
And this is an important part of their physical as well. You take them when they're small to their physicals, and they need to get their vaccines and to make sure they're growing and all that stuff. But it continues to be an important visit each year to still go to their pediatrician, because we create that space. We talk with the kiddo one-on-one to give them a safe, confidential space to talk about these things. And they do often, I feel like, really open up. And it gives us an opportunity also to explain the real risks and the conversations that need to be happening at home, in order to create the safest outcomes and to let them know the risks involved with these sorts of substances.
So yeah, that all is kind of, big things that we touch on with every adolescent visit. And I think, some of the things you can do as a parent at home is just start talking about it. And the American Academy of Pediatrics actually put out a recommendation that says starting the conversation around age 9 has shown to increase awareness and decrease the rates of kiddos experimenting and using drugs. And so that sounds super young, but it's never too early. And the more transparency the research shows the less likely kids will end up abusing substances. And, I would say in general, bring up the subject in a relaxed manner, try not condemning, because if they open up to you and they mention that one of their best friends has tried it, and the parent responds in a way of condemnation where it's like, you can't hang out with them, or that's bad, they're bad, then they tend to withdraw more and they don't want to open up and talk about more of those things. So try not to condemn, just ask questions and be open, find the right moments, if they're busy, if they got a lot going on, it's probably not a good time to talk about those sorts of things.
And other thing I always stress as well is safety around, as they start driving and stuff like that. Whatever the situation is, if it's a situation they need to get out of, or if their transportation option is somebody who's been using a substance, I stress so much that just never get in the car with anybody. And so also creating that who's been using any substances. So creating that safe space too, of knowing that they can come to you without judgment if they need a safe ride, is so important too.
And that's actually the American Academy of Pediatrics recommends, offering like to pick them up, no questions asked, but then rehabbing that conversation, to where, you don't delay it for days on end, but within a day or two, you sit down and have a talk about kind of what happened, what was going on. But that way they feel that you're supporting them, but still are concerned and want to know what's going on. And then normalize non-use, I think, is an important thing that people don't really touch on, where, the statistics show that lots and lots of kids and teenagers have used drugs, but the majority of kids and teenagers haven't by the time they're 12th graders. And so I think it's important that teenagers know, not most kids are not using substances. And that's important because they don't feel like the pressure by the time they're in a 12th grader that they need to have tried it or need to use drugs. And it's okay to say no and move on. You can still have fun without using it. So, all right. So another big topic is nutrition. This is one of the first ways that teenagers and preteens assert their independence is by making their own eating choices. And so we see that, one of the biggest things that teenagers like to do is obviously assert their independence. And this is one of the first early ways they do it, because they can control it. We even see this amongst toddlers and school-age kids. They're starting to assert their independence by making eating choices. So it's important to help guide their choices within reason. And we know that what they're eating directly does impact their brain function. So I wrote here, early nutrient shortages can affect their brain cell growth overall, and later nutrient shortages, if they've gone long times without using certain things, can affect their brain cell size and the complexity of those brain cells and synapses as they form. The different, nutrients, vitamin B, choline, folic acid, iron, minerals like iron and magnesium can affect communication between cells. So I think those are all big important things. And so foods to focus on are a big thing, to know like where to start. Eggs, Greek yogurt, leafy greens, fish, nuts, seeds, avocados, dark chocolate. Those are all kind of big ones that people harp on in the adolescent times. And so things that you're really wanting to hit on hard are good healthy fats, DHA, which is in like lots of fish, nuts, seeds. Those are huge and important for brain cell growth. We know even in the world of obstetrics, mothers that take a lot of DHA, omega-3 fatty acids in their fetus when they're born, statistically, we've seen higher IQ scores in those. So it translates through even from fetus to adolescence. Healthy fats are huge and important. Protein is huge. In the American diet, there's not a whole lot of protein. There's not a lot of focus on protein. It's mostly carbohydrate and fat focused. And so shifting towards higher protein content, and then splitting the rest of it between fat and carbohydrates is kind of the recommended ratios. And then antioxidants, like even dark chocolate, but other things that have antioxidants, fruit and berries, are super important for brain cell health overall.
I think the biggest takeaway that I end up, obviously we're given a limited amount of time in each visit. And I'm sure you've probably noticed that as a parent as well, but I just focus on just try to eat real food. There's so much not real food out there that kids love, like especially Takis and hot Cheetos. And so I just talk about focus on when you go to the grocery store, you want to think about eating foods that exist around the perimeter of the grocery store, your fruits and vegetables, your whole grains, your dairy, your meats, that kind of thing. And just eat real food.
And then, to touch on that too, the things to avoid are your sort of polyunsaturated fats, your processed sugars and things like that. We know that those things cause an inflammatory response in your body, and it doesn't have a preference for any certain part of your body. So it also affects your brain tissue and your brain cell functioning. And so things that are hyper-inflammatory, like processed sugars and foods, tend to, have detrimental effects to your developing brain. Not only that, but the glucose, your brain is one of the main organs that utilizes sugar and glucose. And so if you're getting excess amounts of all of these things, that's not good either. And that insulin resistance obviously can cause issues, but the excess sugar in your brain is also not very good. So important to know those things. And then I wrote things, these are kind of a few different things that you can kind of focus on as a parent in helping to guide that. So I put faux pas because we often hear about these things and teenagers do them all the time. And so skipping meals is one of the biggest things. I don't know how many parents I've talked to that actually have a teenager that eats breakfast. Most don't. And, I'm sure, I think when I was a teenager, I probably didn't eat breakfast. I know my younger brothers didn't. I see the struggle in my parents' faces every morning, but I think that's super important to focus on is not skipping meals, and especially breakfast. And so trying to prioritize that. And eating on the run, I put on there, it's not necessarily, if you can, and you do have time to sit down and have a meal, great. But if you don't, it's okay. And make snacks or pack breakfast the night before, make overnight oats, even eggs overnight or, at night, and then warm them up in the morning, and something that they can take on the go with them. Snack bars even are okay. As long as they have something, when they get to their first couple of classes in the morning, if they don't have any fuel in the tank, their brain's not functioning at full capacity. And so that's going to be super important for developing and maintaining working memory. And, it's super important to start the day off like that. Eating on the run too, in terms of fast foods, I would say if your kiddo is one of the many teenagers that loves fast food, just try and emphasize, smaller portions. They don't have to get supersize everything. You can focus on healthier choices when they're getting fast food, or certain places that are healthier than others. Snacks are important to have. I don't know how many parents, you probably hear it even more than I do now, but so many parents are like, they just eat cookies and chips. That's all they want when they get home. And it's how many times we tell them, just don't buy it. Don't have it around. They won't eat it. Have healthy things around that are more accessible.
And I think not making those things where they're completely off the table. Like, yes, they can have fast food. Yes, they can have those things. But it just needs to be, in moderation. So I think that's the biggest thing, is to not make it where it's totally, absolutely not, but it just is in moderation, and that there's more healthy options around and available for snacks and things than the other things.
Yeah. And then the last thing I put on there was the freshman 15. And while that's something that implies, the first couple of years of college and everything. It's important to set the precedent at this age so that by the time they're getting to college, where there's, academic pressures, there's the stress of new environment, they're maybe homesick and they're just a little bit more stressed, coupled with the unlimited access of food, and the cafeterias and stuff, it's going to really help to, mitigate that weight gain we see in early 20-year-olds or or 18 to 20-year-olds, where they tend to go off to college and gain a lot of weight because of all the stress and access to unhealthy foods. They haven't learned to sort of cope and make good decisions before they go off to college.
Yeah, and I think, and this will kind of segue into our next topic of regarding screen time and social media and those sorts of things. It is not about the weight. It is never about the weight. It is about making healthy choices. And that's what I try not to ever talk about a number. There's some parents who push me for a number that they want for their kid to weigh or to look at the growth chart in certain situations, and it's just not appropriate. I don't want the kid to focus on that. I want the focus to be on being healthy, which is a combination of what you're putting in your body and moving your body every day in some way to get some sort of exercise. So yeah.
All right, shifting gears. So screen time. This is another huge topic we get from parents asking about how much is safe. Does it affect their brain? What, I don't know how many teenagers we've seen that have come in with, sleep problems, depression, all sorts of acting out behaviors. And a lot of it stems from their excessive and overwhelming screen time.
I mean, you see it in toddlers
Mhm.
when they get excessive screen time,
Temper
they get
tantrums.
horrible temper in their behavior. So it starts from then on.
Yeah. According to one study, the average American teenager spends about 7 hours and 22 minutes per day on screens. And that does not include academic screen time. That does not include homework focused screen time. That's just social fun screen time. 7 hours and 22 minutes a day. That's pretty astounding. Some of the big studies have shown that younger school age, so elementary and middle school age kiddos and preteens that are using excessive social media or digital media screen time, it affects parts of their brains that are responsible for visual processing, empathy, attention, the ability to form complex memories, and early reading skills. And so there's actually structural changes they see with it. One of the things you can see in this depiction down here is lower cortical thickness. And so the part of your brain that you can actually see, like the outside part of it, the cortex of it, they notice that it doesn't develop as thick in kiddos that have higher screen Q scores. So kids that are using higher amounts of or excessive amounts of screen time, they actually structurally don't see as much cortical thickness, which is kind of scary to think about. And so some of the big things we see: trouble sleeping, and we see that as related to melatonin. And many of you probably know, because it's kind of a big topic right now, but melatonin is a neurotransmitter that your brain produces that makes you sleepy. And so when the sun starts setting, our brain starts producing melatonin, and that's what helps us fall asleep. Screens, especially blue light coming from screens, directly inhibits that melatonin production in our brain. And so we see kids just not getting tired. Coupled that with the fact that we see teenagers or preteens that are using so much screens, they're not getting tired. So they take a bunch of melatonin every night to go to sleep. And then your brain is like, well, we have melatonin, we don't need to make any. Then all of a sudden your brain stops producing altogether. There's just no more production of it. And so the ability to naturally get tired and fall asleep dramatically suffers. And so that's a huge thing. Lack of sleep, we all know is bad for you, but it affects recall, that complex memory production, attention, and performance.
Yeah, and I think the thing that I stress the most, and I think you'll talk about this as well, but in terms of for related to the sleep piece, but get screens out of the bedroom. All screens need to be out of the bedroom, for two reasons. One, because, we see, like, because of those reasons, it affects both the quality and quantity of sleep that an adolescent gets, that anybody gets, really, for one thing. And then the other big reason too is that screen time needs to be as much as it can. Like, they can be on their device, but in a shared space in a family room, and that kind of ties in more to monitoring and what they're doing on social media and having some oversight in that.
Mm-hmm. So mood changes are a big thing we also see with excessive screen time. I'm sure your teenagers, you can all attest to that. Studies have actually linked increasing screen time to higher rates of depression and poor behaviors in terms of coping ability. And then we see that anxiety when there's no device around, there's heightened anxiety levels. And they've done research that simulate these environments. And we know that kids have a higher anxiety level just because there's no access to screens, which is kind of scary.
Yeah.
The physical changes, like I mentioned before, the cortical thickness is a big thing. And that's something that's been well studied. The Adolescent Brain Cognitive Development program, the ABCD program, that is a big screen time awareness initiative, has shown that this thinner cortical layer of the brain actually is a structural change that we see with it, which is crazy. And then tuning out is something that a lot of kiddos do with it. They're not able to focus as well because there's constant change, there's constant turnover, especially with social media. You're kind of flipping through mindlessly. So their ability to have recall and remember, and they're just not aware. And so that we know has a direct link with developing things like ADHD, where you're not able to focus for very long. The attention span actually decreases, which is a big thing for long-term academic performance, not only in school, but then also performance in a environment where you're working and as an adult.
Mm-hmm.
So what do we do? How do we help? There's lots of different ways you can approach it. A few different ways that have been shown to help are setting app timers. And so if you set social media 30-minute timer on whatever platform or all of the platforms combined, and your smartphone will actually do this and time it out. You can override those, so make sure they're not just overriding all those limits, but set app timers so that they're at least aware, like, oh, okay, I've been on for quite a while. And it's amazing how sometimes you'll notice that you're already out and it's still the morning. So just awareness is I think important. Turning off all screens, like Becca said, at least 30 to 60 minutes before bed will really help, especially with your melatonin production and sleep. We're all guilty of that. We're humans, but it's important. 30 to 60 minutes before bed is what is at least 30 to 60 minutes is recommended. Some other things, set deliberate time to do screens. So you mentioned this before, shared screen time is a big thing. So if you're going to have screen time, if you're going to allow screen time with your kids, do it with them. So like watch a movie or go on some website that you can do activities as a family, or if there's like a game or something that you can do video games together. If you're going to do it that way. Not only are you screening what they're doing, but you're also participating, and that can be a bonding thing if you're going to allow social or screen time. Mm-hmm. It's not screen time related, but exercise has been shown to help mitigate some of the effects of screen time use or overuse, and that sort of directly kind of counters a lot of the damage that screen time can do. So it helps produce, and it increases endorphins. It helps you feel more tired later afterwards. It's just exercise, being outside is huge. And then if your kiddos are into it, keep a journal, and that can help them to express kind of different feelings related to, especially screen time, how they're feeling. Sometimes, like we mentioned, depression is a long-term consequence of excess screen time. And so sometimes that will help with that.
Mm-hmm. Yeah, and I would say that a couple other things that I think are interesting, more information. One that I don't know if anybody's seen The Social Dilemma on Netflix, that was very interesting in terms of looking at social media in adolescents in general. Also, Dove has put out a big, they kind of have different campaigns, but looking at the cost of beauty, and kind of they have a few little short films that highlights some of the detrimental effects that social media can have on young kids and adolescents. So I think those are interesting watches. And then at the end of the day, right, this is information, and you have to do what's realistic for your family. And I think that's where it comes back to having that open communication, which, just like drug, sex, alcohol, mental health, all of those things, screen time is a part of that. You guys can come up with a contract or whatever works for you. We can tell you what the AAP recommends in terms of the amount of screen time and things like that. But you have to decide what's going to be best for your family. And you and your adolescent or your teen can kind of come up with that plan together, so that there's some shared decision-making. It gives them some autonomy. And it creates, again, that open line of communication with them. And the other option too is making them wait 5 minutes, just listening to that AOL dial-up that we all had to do, just so they can experience that. And that could maybe make them a little bit more patient.
So shifting gears to mental health issues, we know this is a time in a human's life where mental health issues really start forming. And so the preteen teenager time is where a lot of these early mental health issues like depression and anxiety, bipolar and eating disorders are all starting to happen. And so we see huge brain developmental changes as they go through, and kiddos that are at higher risk because they have a family history of it are even more susceptible to these sorts of changes. Things like early substance abuse can even more so kick them in that direction. And so being aware of these things is important, and having that conversation too. So 1 in 5 teenagers have a mental health condition, and that's been corroborated by a lot of different studies too. And so things to look for in your teenager, being worried, anxious all the time, that's one of the biggest red flags that is the most common. Also, we see moodiness, decreased interaction with the family, being withdrawn more and not wanting to talk, decreasing their grades or truancy. We see that changes in sleep, changes in eating are all big ones. Some of the things that we can do to help is sleep. Sleep is huge for your mental health. 8 to 10 hours is what's recommended for a preteen and teenager. Encouraging that. All these things we talked about will help. Limiting screen time, exercising, focusing on their strengths, learning to focus and be positive about their self-esteem, and empowering them to focus on things that they're strong at is also shown to help decrease risks of depression. Doing things that make them happy, exercise, like I mentioned, physical activity, and then just talking. If they, have a good relationship with you, great as a parent, but talking to anybody that's a, trusted adult. So if, their school counselor, if they're really close with a teacher, a coach, an aunt or uncle, someone who is a trusted adult is going to be huge for a lot of those things. And we know that because of that imbalance of their developmental areas in their brain, their amygdala, that impulsivity and emotionality center of their brain develops faster than their prefrontal cortex, that decision making and that critical thinking part. We know that there's increase in sensation seeking, and so experimenting with things, trying drugs, experimenting with sex, those are all things that we see, and all of those things can lead to more mental health issues. Couple that with the increased access to social media and stuff, where they're seeing all these things and shows out there that almost glorify mental health issues and depression and make it quote unquote cool, all those sorts of things. So having an open forum to discuss that with your kids is super important, because we know that that preteen and teenager time is super imperative for setting up adulthood with decreasing risks of mental health issues, just because of that imbalance of that developmental areas in the brain.
And just healthy coping skills as well.
Yeah, developing coping skills is huge at that age. All right, concussions is a really big one that we see, or we get asked about a lot in teenagers, and mostly with athletes or kids that are in contact sports, but not always. Anything can cause a concussion. I saw a girl that got a concussion on a roller coaster. So it can happen to anybody. And so concussions are kind of, a lot of people don't actually know kind of what they are or the true definition, but it's truly considered a mild traumatic brain injury. And so that, because of that, it can result in biomechanical and imbalances of neurotransmitters and issues in the way your brain's functioning. They're super complicated, and obviously the brain is very complicated. So responses to concussions can be varying in degree. And they can set up kiddos for long-term issues. There's some statistics out there that show about 135,000 children between the ages of 5 and 18 are treated each year in the ERs with concussion symptoms. And that's seemingly much more underreported than what they expect, because a lot of people who have mild symptoms don't outreach or seek medical care for that. And so one of the big things we see that we worry about is something called post-concussion syndrome. And that's where, for most kids, their concussion symptoms will last a few days, maybe a week or two, and will gradually improve with brain rest and with time. And the post-concussion syndrome, we see those symptoms prolonged, and it can be weeks, it could be months, it could be years. And it's hard to know exactly why certain kids are susceptible to this. Sometimes we think there's some evidence that has shown links to mental health issues also, and imbalances, nutrient imbalances in the brain too, that are predisposing factors to developing post-concussion syndrome. But for some kids, it just kind of happens and we can't predict it. And these kids have a lot of neuropsychiatric issues going forward, which also sets them up for developing more mental health issues. Second impact syndrome is another thing that most people don't know about, but it's very severe and can actually lead to death, as potentially fatal in a lot of cases. And that's where you get a concussion, and maybe it's mild, maybe it's moderate, but you're the teenager, the kid, the adult who has a concussion doesn't seek medical care, doesn't rest, and happens to have another brain injury or impact, some sort of trauma while they're still recovering. And then we see massive swelling in the brain, brainstem herniation, and then potentially even death from that. And so the second impact syndrome is a phenomenon we see that has been coming more and more to light in the world of professional sports and professional contact sports, such as football, boxing, wrestling. And so that's important to know that, these things are long-term outcomes that we worry about. Not to mention, kiddos that have had multiple concussions have increased risks of Alzheimer's, things like ALS and multiple sclerosis and other neurocognitive issues when they're older, obviously. All right, so last is kind of how to guide your teenager. When do we become adults? And that's, obviously different for each kiddo, each teenager. And a lot of the research shows by age 25 to 30, your gray matter has matured and you have a lot of the connections that you will have for the rest of your life. And actually, as you get older, some of those start decreasing. So by 25 to 30, most people consider your brain adult. And that's corroborated by a lot of functional MRI studies and brain scans. But it's important to know that throughout our adulthood, we're continuing to mature our brains. And so that gray matter matures around 25 to 30, but white matter in our brain, the part that connects the gray matter to each other, matures even until it increases until about age 60, I think, is what the research shows. And so we talked about the mismatch in development in different brain areas. And I think it's important to at least have the awareness that that imbalance between that decision-making, the critical thinking, the prefrontal cortex, and the impulse control centers and all of those areas that develop faster. It's understandable that kiddos and teenagers are kind of that moody, impulsive, and we can kind of help support and guide them through that and not get judgmental or angry when they're acting out, because we know that that's a normal developmental thing and that's a good thing. We just want to help guide that. And so I think managing the extremes is kind of the thing. If you start noticing your kids, especially showing some of those mental health red flags, so like being more withdrawn, having grades slip, not talking to their loved ones, decreased sleep and sleep issues, those are all things where you want to involve your pediatricians, your counselors, reach out to a mental health therapist. There's lots of resources in the community that you can access if you just seek them out and ask. But a good place to always start is your pediatricians that are there to help guide you. I don't know. Is there anything else you want to?
Yeah, no, I think that kind of summarizes it, and really that focus on open communication with your kiddo, and then with those involved in your kid's care.
All right.
As a parent of 2 teenage boys, this particular webinar is very interesting to me because you can just look at them and, they're really good kids, but you can just see like things like firing and like
Totally.
their eyes like, I don't know what my brain's doing. And so I'm so grateful for all of this information. It's very, very interesting, especially coming from pediatricians. And we do have a few questions, but I wanted to mention too, I'm very grateful that you brought up concussions, because I feel like, our generations now, fortunately, there are concussion protocols. And I have to actually make a shout out to Chaparral High School athletic trainers and their concussion protocol program for one of my kids to receive a concussion as a soccer goalie. It was just handled so expertly, and I think we all learned a lot about that. So thank you for touching on that subject as well.
Yeah, and I've been lately impressed more and more with their different schools' athletic departments and emphasizing and pulling kids and saying, you're out. Like, if there's a risk of a concussion, you're out. You're not playing the rest of the game. You need a rest, and you have to see your doctor before you can come back. And I've seen that a lot more lately, as opposed to a few years ago, where it was kind of like depending on the coach, depending on the athletic trainer. So kudos to all the athletic departments out there that are doing a good job with that.
And that are following through those kind of return to play protocols. Yeah.
Oh yeah, it's super impressive. So he actually got kicked in the temple because he was trying to catch a soccer ball, and we didn't even see that. And the next thing we know, he's off the field and he's talking to the trainer, and we're like, oh, thank you.
Right.
Super impressive. Anyhow, as far as our questions, one of our first questions is, do you have any tips for finding a counselor or a therapist? This particular attendee, their daughter has been on a wait list for months.
Yeah, you probably are seeing that a lot right now too.
Yeah, I mean, navigating that is really challenging. First, I would say first is to go through the pediatrician, just because they can have resources. We are, like our clinic, we're very fortunate that we have a behavioral health provider in our team. And it's usually used as more of a bridge until they're able to get connected. Unfortunately, so much of it is dependent upon insurance and things like that, where you can refer and where people can be seen. We usually provide a list of like a really thick packet list of options, which is, unfortunate in that it's kind of a lot to try to reach out to from the parent to find someone, but at least it's a place to start for a list. And And then I know a lot of the times, depending on the situation, if a kiddo is in, at least has therapy, then, and if medication is a part of their plan, then a lot of times it's kind of co-managed between the pediatrician and the therapist until they're able to get, maybe more comprehensive psychiatry or something like that, if that's needed.
Yeah, and there are places that are advertising more rapid turnarounds. There's a couple of places I know in the community, and I think including Douglas County, that have more emergency services too, but also offices that will guarantee, from what I hear, admission or a reaching out in a consultation within like a 48-hour period. And you may not see a psychiatrist, you may see a mental health therapist, which is also great. I mean, that's kind of what you're wanting to see. You don't always need a psychiatrist, depending on what your goals are. And if your pediatrician feels comfortable managing medications, if that's the route you go down. But there are places out there that do have faster turnarounds. It's just, whether or not you can find them. And a lot of the pediatricians in the community know about them. And so starting with your pediatrician is a good place to
Yeah, because depending, again, I'm in Aurora, so I kind of know that area better, but yeah, depending on where your location is, that's a good place to start. And then of course, always having the Colorado crisis line, and that your kid always has the Colorado crisis line in their phone. They can also text the word talk to 38255 as well. And so those are good resources to have on hand in more acute situations.
Thank you. That's a very timely question. Another question that we have, speaking of time, what constitutes excessive screen time?
Yeah, that's a tough one. There's no good guidelines out there on like what's too much. Now, the American Academy of Pediatrics unofficially recommends 2 hours.
2 hours, no more than 2 hours a day.
And that's
of
for
non-school.
correct, non-academic school time. And so they say there's no specific research out there that shows like 2 hours is a good amount, or under 2 hours is good and over 2 hours is bad, but a lot of the research was done around that timing. And so 2 hours is what the American Academy of Pediatrics recommends at most for non-academic screen time. And it's age dependent, and that's for preteens and teenagers. For younger kids under 18 months, it's 0. For toddlers to kindergarten age, it's 1 hour max.
And that's, of course, again, the caveat of one, there's real life, you have jobs, you have to cook dinner, you have to get through your day. And so there's real life. And then also, again, whatever that agreement is that you come up with your kiddo, just creating that communication, some sort of a contract or whatever, if you will, with your kid about that.
Great. Awesome answer. I wish it was easier. You kind of have to do what works for your family and your child, and hopefully come to an agreement. Okay, here's another question. The attendee's autistic teen received guidance years ago to use screens for ongoing comfort. There's recent data that makes the attendee viewer about excessive screen time. Do you have thoughts on that scenario?
That's a good question.
Yeah, I mean, I think that's a more specific situation, and I think it depends. Obviously, that's there's kind of a spectrum there, and so depending on the kid and how much it's used for, in some ways, communication and things like that, I think that can play a big factor in it, and also in terms of like educational pieces part of it. I think it depends, I guess I would have to say.
And I think it's important to know what that screen time involves, and if it's just watching cartoons versus educational stuff that is teaching them things to work on communication and working on ways that they can cope. And a lot of kiddos that are on the autism spectrum have issues with emotional and mental regulation and ability to like regulate what they're feeling. And so certain screen time things can be almost comforting or helping with their anxiety with that. And so I think it depends on what your goals are. And I think each kid is totally different. And it's a good question.
Yeah.
And I unfortunately, I don't think there's just a
It's
lot
not
of
a
research.
clear answer, really. Yeah.
But I think if you're doing it and you're seeing positive results in the kiddo, then that's great. And I would say do what works. And if it involves screen time in a healthy way, great. But for the vast majority of preteens and teenagers, that doesn't apply to them. And I think it's just important to know if you're seeing they're doing screen time and it's causing more outbursts or worsening developmental outcomes, then I would say that's not probably the answer for that kiddo.
Thank you for that detailed answer. Another question we had is, you had mentioned exercise is a good solution to sort of undo screen time. Is there a recommended amount of time for that?
The recommendation is an hour a day.
Okay.
That's the
Yes.
recommendation.
Great.
any more or more is great too, but 60 minutes of exercise, and that is
And truly getting your heart rate up, like actually, a lot of times I get a lot of answers from kids about when I ask them their level of activity, some of the exercise they do is, I'm like, well, that really gets your heart rate, so actual exercise, the recommendation is
and
an hour a day.
Kids, preteens, young kids, preteens and teenagers, they don't necessarily need like your rest days. And so that's 60 minutes a day, every day, right? And so unless they're like a dual athlete, they're playing, baseball and football and they're doing 2 days, then, rest days incorporating because they're being active already, right? They're very active. But your kiddo that's, mostly sedentary or gets limited exercise, 60 minutes a day, 7 days a week of physical activity. And that could be walking your dog or, jogging with your dog, maybe walk, jog sort of thing, like over an hour period of time, or going to the park and playing. It doesn't have to be, running on a treadmill for 60 minutes sort of thing. It can, you can make it how you want to make it.
Yeah. And I talk about that with my patients a lot too, since they're often more, have less resources. And so talk about utilizing either the local rec center, is one option. And it's kind of sometimes be more of a community opportunity for exercise. And then, if you love to dance, like dance for 45 minutes, whatever, different things like that, just to, so it doesn't have to be like, let's go get swole.
And I would always encourage my parents to do it with them, because if they see you doing it and you're holding yourself accountable to doing it too, then that just more encourages them to do it. And you can make it a family thing, like, hey, let's all go for a bike. Yeah, a bike ride is a great thing to do. And you can do it with them. I see people in the community all the time riding bikes with their kids, and I think it's great. I love seeing that out there. And so if you make it normal and you make it a routine, it'll just become habit, which is good.
Oh, it's a great answer. I laughed when you said rest day because it's like my favorite day of the week. Rest day.
But adults, we need rest days, but teenagers don't.
Yeah, probably not. We have one final question. If you could recommend any vitamins for teens and preteens, what would those be?
I think in general, the guidelines say, as long as you're eating a well-balanced diet and healthy foods, you don't really need to take vitamins. And so vitamins are important for kiddos that have certain dietary restrictions, kiddos that—
Or vegan diets.
Yeah, vegan diets. They're missing certain macronutrients in their diet that you can supplement with. But the recommended way to go about it is eating a well-balanced diet and eating all of your food groups. If you have a super picky kiddo, or you have a kiddo that has, let's say, autism spectrum disorder and has texture issues, sensation, sensory processing stuff, and they're like, I cannot eat anything that's crunchy. That limits a lot of fruit and veggies and stuff. And so, supplementing with vitamins can help in those regards.
Sure.
The other part of that too is, we often see it more in adolescent girls. Girls often will take about 25% less calories per day than teenage boys will. And that puts them, especially once their menstrual cycle is starting, that puts them a lot more risk for nutrient and vitamin deficiencies. And so your preteen and adolescent girls that, maybe aren't eating as much or are having their periods and, having bone density issues later on and things like that. Important to do certain things like calcium, folic acid, iron, all those sorts of things are really important.
Yeah. Focus first on getting all of those nutrients through the food source. And then if there's specific circumstances, like you mentioned, those examples, those would be ones where you would want to then supplement. And then, like you said, iron in those menstruating females, menstruating adolescents. And then I think vitamin D, I think we're all pretty vitamin D deficient, even here in Colorado, just because we now are so much better about sun protection and all of those things. And so a lot of us tend to be deficient in vitamin D.
And it never hurts to take a multivitamin or in general, if it makes you feel better, as long as you're eating a well-balanced diet, you don't really need to. And that's kind of the big thing.
The big takeaway.
Yeah.
Great. That's a wonderful answer. Thank you. And just like that, we're out of time. Thank you to both of the pediatrician doctors. We're very grateful for your time and not only all the topics you discussed, but the solutions that you offered as well, because we all need those, let's face it. So and thank you again to Skyridge Medical Center for partnering with Parent University. This is our last Parent University webinar for the academic year. So please tune in on social media and all of our emails and newsletters from the school district about continuing to attend these. And this particular webinar will be, or has been recorded and will be posted on our website, our Douglas County School District Parent University website, as well as the Douglas County YouTube channel. So lots of ways to see it. And with permission from our pediatricians, I can send this out to all of our attendees as well. So thanks again. You guys rock. We appreciate it. Have a great evening. Thanks.
Yeah.